All right, everyone. Today I'm going to be talking about mechanoreceptors and their role in managing pain. So what exactly is a mechanoreceptor? What are they? Well, mechanoreceptors are any sense organs that respond to vibration, stretching, pressure, and other types of mechanical stimuli. Why are these important when it comes to trying to manage pain as a manual therapist? Basically, these mechanoreceptors are associated with a sensory neuron. So something that sends an afferent message up to the brain. And these sensory neurons that they're associated with are A beta fibers. Why is it important that they are associated with A beta fibers? Well, if you remember me talking about in my last video how the message of pain is received in the brain, I talked about C fibers and I talked about A delta fibers. The C fibers are responsible for that slow, chronic, kind of deep aching pain. And those A delta fibers are responsible for that fast shooting pain. Take your hand off the hot stove, or jump when you step on something sharp. That sort of response. Now it's important to differentiate between all of these fibers because all of these send messages up to the brain at different speeds and in different ways. Okay, so the C fibers are fairly small. They are 0.2 to 1.5 micrometers in diameter, and they send messages up to the brain at about 0.5 to 2 meters per second. A delta fibers are slightly bigger. They are 1 to 5 micrometers in diameter, and they send messages 5 to 35 meters per second fast up to the brain. Okay, and this is where the important part comes in as to why these mechanoreceptors are so important to managing pain. The A beta fibers are way larger than the C and A delta fibers. Okay, they are about 6 to 12 micrometers in diameter, and that means they can send messages at 35 to 75 meters per second fast to the brain. Okay, so because it's bigger, it can send more information faster. So now that we know that if we affect these mechanoreceptors, that it can send messages faster to the brain than these C fibers and A delta fibers that are associated with pain, we now know why it is important as a manual therapist to know how to stimulate these. So on this page, I'll talk about the 4 main mechanoreceptors. We have Merkel's discs. We have Meissner corpuscles. We have Pacinian corpuscles. And lastly, Ruffini endings. All of these are stimulated in different ways. All right, the Merkel's discs are stimulated by sustained touch and pressure. Meissner corpuscles respond to changes in texture and slow vibrations. Pacinian corpuscles respond to deep pressure and fast vibrations. And the Ruffini endings respond to sustained pressure as well as skin stretch. Okay, so if you think about all of these and how they are stimulated, it's pretty evident that all the manual therapy techniques you use to affect the brain, do your treatments, all of the manual therapy techniques that really work on a skin level, such as cupping, massage, floss bands, self-myofascial release. Basically, all those are affecting the nervous system through these mechanoreceptors. So, if you know how all of these work, how they respond to different things, you then have an avenue to create a way to send a message faster to the brain than what they're feeling, than what your patients might be feeling, which is pain. So real quick, I'm going to attempt to draw a model of the skin, and I'll show where each of these are located. So the Merkel's discs are the most superficial ones, which makes sense as they respond to sustained touch and pressure. Meissner corpuscles are the next ones. Corpuscles, goodness, can't spell. And they respond to changes in texture and slow vibrations. And then we have Ruffini endings. Which respond to those sustained pressure and skin stretch. And then the deepest, we have the Pacinian corpuscles, which again respond to deep pressure and fast vibrations. So if you can see where they're at in the skin, the two mechanoreceptors that start with M, they are going to be the superficial ones. And then the other two, Pacini and Ruffini, are deeper in the skin. So when we're thinking about our manual therapy techniques, once again, know where all of these are at in regards to the skin and how you can affect them. And once you learn the basics of this and you know how you're really affecting the brain and the pain cycle with your tools, I believe that your tools become way more useful because you can manipulate them and use them even in ways that aren't necessarily instructed to take care of pain. I'm hoping to come out with more videos as to why certain things work, especially in regards to the nervous system and pain. Next thing I want to hit on are different laws of the body, especially neurological laws that can be helpful to your understanding of how to affect pain. But that is all I have for you guys today. I'm going to do a real quick recap with the camera over what I just wrote. That is all I have for you guys. Thank you again for watching. Please drop comments below on what else you'd like to see, what you want to know more about, and thank you for the support.